Have you ever tried to get someone to do something that you know they will love? Like getting a child to eat a new type of food, or persuading a friend to try a new sport, or maybe even a spouse to try something you loved growing up and you think they would too. Well, this sometimes doesn't go very well. The more you push, the worse it gets. And in the end, if they do end up trying it, they do so with a bad taste in their mouth and they don't enjoy it. Well, let me let you in on a secret. We do the same thing with improvement projects all the time, especially at the time of project closing. We spend a ton of time defining the problem, choosing measures, identifying the root causes, testing ideas. And then in the end, after spending months falling in love with our project, we expect someone else to buy into it immediately. Remember, it took us weeks to months to agree with the changes we finally decided to implement. And now we want someone to adopt them in a day. One important way to address this challenge is to intentionally take the time to sit down, discuss with your team, and calculate the project impact. This becomes an important step too often missed in improvement work.
Measuring impact, right, really gets at the root of a quality improvement project. It really focuses on what matters and why the stakeholders should care, what's in it for them.
A few years ago, I was working with a team with the goal of decreasing length of stay for a specific patient group post-surgery. The team ended up using hours from admission to discharge as the primary measure for their project. After 4 months of work, they displayed the following chart. Each point representing a patient procedure, the y-axis showing time in hours. With excitement, they proclaimed that time from admission to discharge had decreased from 30 hours to 20 hours, and they felt like they had made it. You may look at this and think, okay, so why does this matter? Or why is this meaningful? And guess what? Your questions are spot on. Oftentimes, project teams get so married to their project measure that they forget the outcomes that people really care about. The outcomes that may have caused the project to start in the first place. Mathematician and physician Dr. David Eddy taught that teams must understand their causal chain, or the chain that connects project actions to meaningful outcomes. When closing healthcare improvement projects, we often just present the measured project outcomes, that middle part of the chain, which may mean a lot to the presenter, but very little to the audience. So going back to the example on reducing length of stay, the team had put changes in place that resulted in a length of stay decrease of 10 hours. As they prepared to present their project to process owners and other stakeholders, they calculated the what really matters outcomes and found the following. By decreasing time to discharge from 30 hours to 20 hours, they increased the percent of patients discharged the same day as their procedure, from 40% to 80%. This ended up increasing patient comfort, satisfaction, and decreased post-operative complications for approximately 200 patients per year. Getting more patients home same day also decreased hospital accommodation costs by about $100,000 a year. Provider wellness also increased due to less required early morning rounding, saving providers about 2 hours a week. Now, note in doing this, in going through all these outcomes, they hit on multiple perspectives important to institutional leaders. Patient satisfaction with the first one, financial strength with the second one, and provider wellness with the third. Do this with your projects. This will give clear, easy to speak to outcomes that leaders and other stakeholders can pull on when talking about you and your team.
I remember actually presenting this project, the same-day discharge project, to our division meeting of physicians, surgeons, and after presenting the project, one of the surgeons sort of raised their hand and pretty bluntly, sort of asked, where is this project coming from? Who's pushing for this project? Is this just the hospital that's trying to push patients out sooner so that they can make more money? Knowing that there are multiple stakeholders involved, that certainly the hospital is a stakeholder. We know that same-day discharges does save money. It frees up beds, it makes the hospital more efficient, but that there's also other stakeholders, including the patient, right? I think we all value patient care. We know that same-day discharges of minimally invasive hysterectomies are really standard of care. They're safe. We know that patients are happy, they're evidence-based. But then also bringing up the stakeholder of the physician, that First, I think knowing that our patients are satisfied and comfortable at home going home after surgery is really nice as an impact for the surgeon. What's in it for me? But then also having your patient go home the same day and not having to round on them in the morning can save you maybe an hour or two of time a week that, we can all use time back to improve our well-being. So I think that really defining impact for every stakeholder was important.
One difficulty many teams face is the financial calculation. Let me offer a few words of advice. First, keep it simple. It just needs to be directionally accurate. Don't overcomplicate this. You will not get your spouse to try your favorite hobby if it takes an hour for you to explain why you love it. Second, not all improvement initiatives have financial impact, which is fine. Don't make up a financial impact if it doesn't have one. Just like if eggplant lasagna isn't tasty, don't try to convince your kid it is. Third, use a shared list of calculation standards for hard to calculate cost outcomes. You shouldn't have to recalculate the cost of a hospital-acquired infection every time a new project works on it. Use a shared standard to reduce analysis burden. Again, if it's directionally accurate, it's fine. Here are some calculation standards I have personally found helpful. You can use these if you'd like, but ensure they are supported by your leaders. Feel free to pause the video here to review. Notice some of these say soft dollars and others hard dollars. This just means that the financial impact you calculate may rely on some key assumptions. For example, reducing length of stay can have a positive financial impact only if you have enough demand to fill the newly opened bed. Or decreasing missed appointments positively impacts contribution margin only if you have patients waiting to get an appointment. These are soft dollar calculations. Hard dollar calculations mean that the cost will be removed, such as renegotiating a contract for a supply item, or eliminating use of a traditionally used lab test. For quality and safety outcomes, many organizations have come up with a shared list of how much it costs for a readmission, or a hospital-acquired infection, or even a patient fall. Talk to your local quality team to find those estimates, which can also be hard dollars. To end this video, let me provide some examples from different outcome perspectives. In this example, the project team had increased staff productivity by streamlining lab processing tasks. Employee engagement and productivity in the lab had improved. To calculate the impact, they measured how many minutes per day were eliminated by the new improved process, and then multiplied this number by the number of people involved. And then lastly, summed up what this would be over a week and then a year. To help with the storytelling, they also included staff quotes that confirmed the time savings was appreciated and that it was meaningful. For example, "I so appreciate the new process and feel much more productive in my work." Here's some more examples. Please pause the video here again if you want to take some time to review them. So going back to the common situation about getting someone to do something new. Know that first, understanding the impact of your work, second, documenting it, and third, speaking to it from many perspectives will greatly help your pitch. It will also help you get ongoing support of doing improvement work, as leaders will remember the type of impact you had and can pull it up and share it with others. I invite all of you to consider the outcomes for the projects you work on and make this step, calculating the project impact, a deliberate part of every project you do.